Well, now some new information on your risk of developing cancer. Two new studies just out tying sleep apnea, a common disorder that causes snoring and dangerous pauses in breathing at night, to cancer. Some 28 million Americans have some form of sleep apnea, and one study finds that those with the most severe forms, the most severe, have a 65% greater risk of developing cancer. Joining us now, Dr. Ernest Patty, Senior Attending Physician of Emergency Medicine at St. Barnabas Hospital. So, Dr. Patty, you say something like 65%. That gets a lot of folks' attention. What exactly is the tie here?
Good morning, Jenna. Yes, it's very exciting new research. The tie is that they feel that people who have sleep apnea, not only do they have an increased risk of cardiovascular disease, that relationship's been established quite well, but what they're seeing now is that in both those studies, one done in Spain and one done in Wisconsin, both of them showed an increased risk of cancer of any type in patients that suffered from sleep apnea.
So, Dr. Patty, is that from just not simply getting enough rest, or is there something more physical happening with the sleep apnea, not getting enough oxygen because you're waking yourself up, you're not breathing deep enough? Tell us about what potentially is going on.
That's the key, Jenna. You mentioned it. When you have sleep apnea at night, your body basically starves for oxygen. And what is well known in cancer is that cancer tumors and cancer cells need oxygen to grow and to thrive. And what tumors are large clumps of blood vessels. They did some research in mice, and in the mice they found that those who were put in environments with low oxygen, basically they were starving them for oxygen, their cancer tumors developed many more blood vessels to try and capture more blood to deliver what little oxygen was in the blood to the cancer tumor to help it grow. So the theory is that that possibly could happen in humans, and people with sleep apnea would be living throughout the night in an environment where the oxygen level is low in their body.
And for years, right, Dr. Patty? People with sleep apnea are suffering for a long time. So if someone has sleep apnea out there, what is it that they can do to correct that?
Well, there's a lot of exciting treatments that they do. There's some surgical procedures. There's what we call cpap, or continuous positive airway pressure, which is a little more cumbersome, but what it does is it basically forces air into your lungs at night to keep your oxygen level up. And it's very effective, but some people find it tough to sleep with this apparatus on their face.
Right.
And there are other new treatments that are coming out, certain surgical devices that you could put on to keep the airway open and free. The problem is a lot of people who have sleep apnea are also very overweight, suffer from obesity, and that adds to the increased chances of having sleep apnea.
Dr. Patty, when we get these studies, we always want to share it with our viewers because there's always something new and interesting. But the more and more we do it, we also get the feeling it's like everything causes cancer, right? It doesn't feel like we're getting any closer to really figuring out how to fix the cancer issue, because if you don't sleep right, you don't eat right, you're going to get cancer. What do you think about that?
As we've spoken many times before, when I'm normally in New York with you, we have to make sure we do things in moderation, we maintain a healthy lifestyle, we eat nutritious foods and exercise. But one of the key things that we all forget about in our high-stress society is we forget to rest. We forget to sleep. So these people with sleep apnea are definitely increasing their risks of bad health, and I guess down the road that could lead to things like cancer.
Very interesting, Dr. Patty. Gives John even more of an excuse just to take a nap after the show. You know what I mean?
Most definitely.
I am ready right now.
I'm down here at the American College of Emergency Physicians meeting, the national meeting. And they just wanted to get a little plug in for them. They're a wonderful organization here in the United States of emergency physicians, of which I'm one.
Well, we know that we depend on our ER doctors a lot, Dr. Patty. So thank you very much. Nice to have you join us from D.C., and we'll talk to you soon.
Thanks so much for having me, and we'll see you back home. Thank you.
Say hi to all of his fellow attendees, his family, and